Hey everyone. Today we're going to dive into a condition that primarily affects newborns and young infants called biliary atresia. It's an important topic because, while it's relatively rare, early detection and treatment can make a big difference in the outcome for these little ones. By the end of this video, you'll have a clear understanding of what biliary atresia is, how it's diagnosed, and the treatments available. If you're studying for your exams or just love learning about complex medical conditions, be sure to check out King of the Curve for all your learning needs. So, what exactly is biliary atresia? Well, let's break down the term. Atresia refers to the absence or closure of a normal body passage, while biliary has to do with the bile ducts, or gallbladder. Put them together, and biliary atresia means there's a blockage, deformity, or even a complete absence of the bile ducts. Biliary atresia is a condition that affects newborns and young infants, and it can either be present from birth, meaning it's congenital, or it might develop shortly after birth due to inflammation. The exact cause of biliary atresia is still a bit of a mystery. It's generally thought that some viral infection or toxic exposure might trigger inflammation and damage the bile ducts after birth. There are also potential genetic factors involved, with mutations like those in the CFC1 gene, which plays a role in the development of the left-right embryonic axis. It's not entirely clear why biliary atresia occurs, but it's likely a combination of both genetic and environmental factors. Now, let's talk about how biliary atresia presents itself. The most noticeable symptom is jaundice, which is the yellowing of the skin and the whites of the eyes. This happens because bile, which normally flows from the liver to the intestines, gets blocked. With nowhere to go, the bile leaks into the bloodstream, causing an increase in conjugated bilirubin, which leads to the yellowish tint we see. Newborns with biliary atresia also often have aholic stools, that means pale, clay-colored stools, and their urine might be dark. Additionally, there might be an enlarged liver known as hepatomegaly. Let's dig a little deeper into what happens on a cellular level. In biliary atresia, the obstruction of bile flow, also known as cholestasis, leads to bile building up within the liver. Over time, this causes damage and inflammation to the liver's cells, eventually leading to fibrosis or scarring. If left untreated, this can progress to secondary biliary cirrhosis and portal hypertension, meaning high blood pressure in the veins that supply the liver. This can lead to serious complications down the road. Diagnosing biliary atresia involves a few different steps. First, blood tests can reveal conjugated hyperbilirubinemia. That's a fancy way of saying there's an elevated level of conjugated bilirubin in the blood. There's also typically an increase in liver enzymes like aminotransferases, alkaline phosphatase, and GGT. An ultrasound can be used to check for the absence of the gallbladder or any dilatation of the biliary tree. In many cases, doctors might also perform a liver biopsy, which can show inflammation, bile duct degeneration, and fibrosis. Finally, hepatobiliary synthes scanning, or HBSS, might be used. This is where a tracer is injected and followed to see if it reaches the intestines. If it doesn't, that's a sign of a blocked biliary system. In some cases, intraoperative cholangiography, taking X-ray images of the bile ducts during surgery, is needed to confirm the diagnosis. The primary treatment for biliary atresia is a surgical procedure called the Kasai procedure, or hepatoportal enterostomy. Here's how it works. The surgeon removes the damaged bile ducts outside the liver. Then, a segment of the small intestine is cut and attached directly to the liver, creating a new pathway for bile to drain. This bypasses the blocked bile ducts, allowing bile to flow from the liver directly into the small intestine. While the Kasai procedure can be effective in restoring bile flow, it's not a permanent solution. Many children with biliary atresia will continue to experience liver damage over time and may eventually need a liver transplant, often by the age of 2. Unfortunately, even after surgery, complications can arise. Cholangitis, which is an infection of the bile ducts, occurs in about 50% of cases. Portal hypertension, or increased pressure in the portal vein, happens in more than 60% of children with biliary atresia. If biliary atresia goes undetected or untreated, it can lead to early biliary liver cirrhosis, often around 9 weeks of age, and without intervention, children may not survive beyond the first 2 years of life. Let's recap what we've learned. Biliary atresia is a condition where the bile ducts in newborns or infants are blocked or absent, leading to a buildup of bile in the liver. This causes jaundice, pale stools, and dark urine. Early diagnosis and treatment are crucial, and the main surgical option is the Kasai procedure, which helps restore bile flow to the intestines. However, many children may still need a liver transplant later on. This condition, while serious, can be managed effectively with early intervention and treatment. And that's biliary atresia in a nutshell. If you found this video helpful and want to explore more about different medical conditions, be sure to check out King of the Curvy. Our platform offers interactive content and resources to help you master complex concepts. Don't forget to like this video, subscribe to our channel, and hit the notification bell so you never miss an update. Thanks for joining us, and I'll see you in the next video.